CEO of Grand Rounds. Do you want to tell us a little bit more about what you guys are working on?
Sure. Grand Rounds' goal is to make everybody a medical insider. Turns out that if you're a medical insider in this country, you get a level of care that is different from everybody else. You get access to hospitals that you wouldn't otherwise get access to. You get access to physicians. You raise the level of the game that we're playing in healthcare. If you access one of our doctors, you don't have to be sitting in front of your iPhone talking to them. And there's great reasons to do that too. I used Doctor on Demand yesterday for a different reason. But they do have times that open up during the day, and they'll have a cancellation. They'll have a surgery that gets postponed. They'll have their administrative day where they can actually do research and other sorts of activities. And it's really awesome. They plug in interstitially with those moments, and they can do nighttime activities. We were mobile first with our physicians because we wanted to have them be able to work on an iPad while they were traveling to a conference or whatever.
So you guys talk a lot about quality. What do you mean by that?
Quality. Yes, so quality is not what hospitals mean. So when a hospital says quality, what they mean is safety. It's kind of like when you walk up to a restaurant and you see in the window like an A or a B and you think, well, the food's going to taste good if it's an A. All that really means is that you're not going to get E. coli from that restaurant. So similarly, when a hospital or any medical practice group talks about quality, they really mean safety. You're not going to lose blood in a surgery. You're not going to get an infection that you didn't expect to get when you started the surgery. When Grand Round says quality, I think we mean it in the more consumer, broadly understood way, which is the outcome will be high quality. It will be what you desire. It will be a fine product. And so our ambition is to find quality where it exists in the healthcare system. And ironically, nobody's really ever figured that out before.
How do you find these doctors, and what are you looking for when you're going out and talking to them and kind of signing them up to be on your service? What does that look like?
So a lot of people ask me that question. They assume that that's the hard part of our business. In fact, it's the most straightforward part of our business. So doctors want to practice with other great doctors. The expression is practicing at the top of your license.
How did you kind of set up that network then? How did you get your first few doctors to kind of be on your...
So I'm going to give away the secret. I'm going to tell everybody in Rock Healthland how this works because it's really hard to copy it. I have an amazing co-founder. So my co-founder is Rusty Hoffman. He's the chief of interventional radiology at Stanford, has spent his entire career at Stanford or Johns Hopkins. And he is the world expert in DVT, the kind of clot that forms in your veins and your legs in particular. And he's good at a lot of things in interventional radiology, but on that one particular thing, he's really amazing. He, despite his considerable gifts in healthcare, despite being in the place that he was at Stanford University, didn't have the answer individually, and the team at Stanford did not individually have the answer for when his son fell really gravely ill. In fact, likelihood was that his young son would not have made it except for the expertise that Rusty was able to get from other places in the country, the National Institutes on Health, the Fred Hutchinson Center in Seattle, which was expert on this particular condition. We started to gather other doctors around him who wanted to kind of be in that universe, and it naturally progressed from there. Today, we have a waiting list of doctors. In fact, we get more requests to join the panel than invitations we send out, which is really one of the counterintuitive parts about our business. Everybody assumes we're in full recruiting mode, and we're really not.
It's a great position to be in.
It is.
Yeah. So you came
I'm going to drop the mic and just walk off the stage.
So you came from tech. You were co-founder and COO of Reputation.com.
Yep, that's right.
So what inspired you to jump into healthcare? What was that process like?
Yeah, two things. One, I'm the son of a pediatrician who was both a wonderful dad and a really good doctor, and I always looked up to him, and I wanted to be like him. Turned out I wasn't particularly fond of blood and guts and all the stuff that goes along with that. And so my gifts really were more in the technology domain. So I really always wanted to get back to healthcare. Two, and I think I would put this charge out to your audience, that the thing that we should all be doing, those of us who have had some success in other technology ventures, is we should be thinking about the things that we want to tell our grandkids about after we've built them. And I see a lot of the moment tech that's being built, but I don't see a lot of companies generally, and this is not a comment about healthcare, it's in fact a comment about the rest of tech. I don't see a lot of companies that I think will be around in 50 or 100 years. I don't know that Grand Rounds will be, but we're building it. The culture of the company is we want to build something that we think will last, that will have an impact on hundreds of millions of people potentially over the fullness of time. That's the kind of company that I wanted to build. But but I would encourage everybody who has interest in data, interest in apps, interest in consumer-facing technology to look at this industry, because there's so much going on here and so few good companies and good solutions.
How do you pick, I feel like a lot of friends I know who are in tech, they say, I would love to start a healthcare company, but I went to the doctor like a year ago,
right.
and my mom used to take me to the doctor before that. I don't have much experience in healthcare. I don't know where the problems are. You can pick out something or go about finding something to actually work.
That kind of thinking of let's go sit in front of a whiteboard and pick a problem is totally wrong. Because one of the great things about healthcare is that everybody has gone through it. And so you may be blessed with great health, and good for you if so, and you may be good at maintaining that health, but I guarantee you there have been things that have happened to you in your life, or things that have happened to people you've cared deeply about, or decisions you've had to make about your own healthcare. Start with that. Start with what was imperfect about that experience for you, and start pulling that thread. And pretty soon I think you'll find an answer.
What's the most important thing you look for when you're building your team?
Fearlessness. Because this mountain we are trying to climb, there have been hundreds of explorers in front of us, and we were not the first one to raise our hands and say there are problems in the healthcare system and we think we can fix them. Other people had come to that conclusion. But some of those dead bodies we see as we're climbing the mountain, because they realized that on the way up, they wanted to poke the bear, they wanted to do something that was a little more risky, they didn't... they lost courage and just kind of gave up and sat by the side of the road. And this is a big industry with some very large installed players that frankly are not as inviting and as welcoming of the disruption that companies like mine are bringing.
So how do you find those people, and how do you kind of keep them focused on your mission?
Finding the people, they're out there. People want to work in healthcare. They want to work in health tech. They want to work in companies they want to work for companies they believe in. They just have never been asked. And back to your earlier question, so many people are fearful of this space. They think there's some insider knowledge that we couldn't possibly have unless you'd been a 10-year vet in the healthcare industry. The thing that we try to not do too much of is teaching you everything about healthcare in the space of 2 weeks, because it'll be too easy to become another one of those drones that's been working in the industry for the last 100 years. Rather, we'd let you come in with your own personal experiences, the tapestry of your family life, the cancers they dealt with, the injuries you've personally experienced, and apply those lessons to how you want to see the product build.
What kind of companies are you hiring from?
So I've been surprised by this, because the companies that we're hiring from look more like the companies that you'd think would be unapproachable for talent. So we are hiring from Palantir and Facebook and Google and companies like that. Not because the people who are coming from those companies expect some sort of different economic proposition, but because in a lot of times those people went to those companies because they thought they were on a mission that the company was going to stay on, and they found that they were working beneath 30 layers of management on a product that may or may not ever see the light of day. And so what I've been most surprised in a good way by is that in our hiring, a lot of those people are raising their hand and saying, yes, we have all this stock option wealth that we're walking away from, but really for us, it's the quality of the work. And I think I would invite my peers to continue to think about selling on the kind of work you're going to be doing rather than how big is the market and what is your ultimate percentage ownership of the company and what is that going to translate to. Those things are important, but I think the best kind of workers are the ones who are there intrinsically because they feel connected to the work.
Let's talk a little bit about regulations. So I know that there's some challenges with telemedicine regulations. How are you guys approaching working across state lines with doctors kind of advising patients that are maybe across the country?
Yeah, it's a kooky problem, right? Somewhere along the way, we decided that a human being in Massachusetts was anatomically different than a human being in California. Therefore, doctors couldn't possibly be credentialed to work on both. I mean, it's really a backward set of conditions that we live in. So there are a couple models for this that I think are worth knowing about. The more typical one is you provide advice. So you don't say that this is actually a physician-to-patient interaction. You're providing an educational product. You tell the patient it's just there for their learning, that ultimate care and review needs to be delivered by a local physician. The other model is to do a kind of state-by-state licensing of physicians so that you can actually have and maintain a patient-to-physician relationship. Grand Rounds goes that direction, and where we can't license a physician or don't have a physician licensed in state, we get a release from the treating physician in the state that the patient actually resides. But we can practice in all 50 states, the territories, the District of Columbia, et cetera. And that's an investment. I think entrepreneurs, if they want to grow their business to a certain size and scale, would be well advised to make that investment early, because I think getting that right so that you feel like your dream of what the company can be is not torpedoed later by a few state medical boards is a good idea. And get a good lawyer. That is a lawyer worth spending money on, more so than your corporate lawyer, frankly. The lawyers who know about health regs, state by state stuff, those are the folks you should be talking to.
I want to go back a little bit and talk about working with patient data. What's kind of the biggest challenge with security that you see now? And I think that there's a lot of changes that are happening, regulatory changes. What do you think the biggest challenge is in working with patient data in the kind of digital era?
How long do you have? So the law is way behind the times on this. So HIPAA, which is the kind of longest running and largest single kind of set of documents associated with security and privacy and portability, basically has trained people to believe that the most secure way to transmit records is to print them out, put a cover sheet on them and say, please don't look at these things, and then fax them all around the country. That is not secure. And so I think if you work to the letter of the law, you're going to find yourself not honoring the security you'd want for your own family members. So I think the big challenge is keeping everybody up with the speed of kind of privacy and technology innovation that's already happening in best-of-breed Silicon Valley technology companies. I think the other thing that we're paying attention to, which is related, is how do you become interoperable with other large EMRs and large systems? So at Grand Rounds, we have to do a lot of work just to collect the medical records to make our patient experience hum the way that we want it to hum. If I ask you as our patient to go get the records for yourself, that's an awful start of your use of our product. So we don't want to do that. We want to do that for you. But we are way ahead, and this is not, I think, a bragging statement as much as just a despairing statement about where the rest of the industry is. We're way ahead on the ability to collect, digitize, and make that information usable for people. I would love to see a bit of a groundswell from other technology companies that are interested in digital health to go to Washington and say, hey, we need to accelerate the meaningful use stuff. We need to accelerate interoperability. We need to hold the healthcare system accountable to patient data and usage. I mean, we figured it out in cell phones, right? You can port your cell phone number now. We should be able to do it in healthcare.